So tell me your name, where you're from, and your background.
So my name is Jo Lechowicz. I'm an oncologist or medical oncologist at the Winship Cancer Institute at Emory University in Atlanta, Georgia. I'm originally from the suburbs of New York City, where I trained at Columbia and was a chief resident there at Columbia. And then I went to Hopkins to do virally related malignancies before I came to Winship.
Great. And so how did you first become interested in Castleman disease?
So, my mentor asked me to think about kind of questions that I would ask. And I was always fascinated by the idea of the immune system and virally related malignancies and or pre-malignant. And so, unfortunately, there's always a fascination with patients that are incredibly ill. And how do we could we have done something better? Can we treat them? And so there was a number of Castleman's patients when I was a house officer at Columbia and when I was at Hopkins that we sometimes did well by and sometimes did not.
Right.
And so that always makes you think about how do we make it better for the next person?
And as far as that goes, what are some new advances or research you're doing that you're excited about for the future?
So I think that, the network itself has created a lot of great experiences in terms of comparing notes about this rare disease. And so thinking about sort of guidelines with regard to different symptoms and different patients, and really being able to have a collaboration for patients and for researchers across the country to sort of talk about how is this patient different from other patients and what's the best route for them. The beauty of it is that we can really give personalized medicine to these patients as we have some newer drugs to treat them with.
Yeah.
But we still obviously always have a long way to go.
Mm-hmm. And what advice would you give to other researchers or physicians that are interested in getting more involved?
Although we are farther than we were a decade ago, we are far from a cure. So don't give up.
Mm-hmm. And what about patients who maybe were recently diagnosed?
Our network is phenomenal with regard to who our founder is, in terms of, not only a phenomenal scientist, but a patient advocate who has known the suffering himself. And I don't think you can ask for better. There's no better advocacy than that. Mm-hmm. And make sure you go to a place that actually has seen the disease before, so that you have the right diagnosis so that we can care for you in the best way we know how.
Wonderful. Thank you so much.